Hello, this is Siddharth Damber from Chicago Arthritis and Regenerative Medicine. Welcome to our webinar today, Regenerative Medicine Treatments for Shoulder Pain. Hope everyone is doing well. What you will get from this webinar today, you'll learn about the best available non-surgical treatments for your shoulder pain, rotator cuff tendonitis, rotator cuff tendon tears, shoulder arthritis, shoulder injuries, including slap tears and labrum tears. In addition, you'll also learn about what is considered legitimate and not legitimate in the field of regenerative medicine, because that's important. You'll also learn about the 9 things your physician must know if they are an expert in regenerative medicine. And if you have questions, please go ahead and put them on chat. So big question is, what would you do if your shoulder pain was controlled? How would your life improve? What exercise would you restart? What activities with family and friends would you participate in? So who am I? My name is Siddharth Damber, physician at Chicago Arthritis and Regenerative Medicine, specialist in rheumatology, in addition, specialist in image-guided musculoskeletal injections. I've been in practice since 2008, involved in regenerative medicine since 2008 as well, and within the Regenix Network since 2012. The Regenix Network is the largest network of affiliated physicians in the world that participate in regenerative medicine. So the reason why we're talking about regenerative medicine is because there are problems with traditional care when it comes to your musculoskeletal health. That includes that traditional care for shoulder pain includes generally pain medication, ice and rest. You can mask the pain. There's really no attempt to fix the problem, and frequently you're just waiting until you actually require surgery. That's a real problem. There's problems with this because lots of problems with pain medications, including chronic anti-inflammatory usage, NSAID usage, a lot of issues with that. Namely, it can cause a lot of side effects such as kidney, stomach, liver, heart, and bleeding issues. Chronic opioid issues are significant as well. Namely, we know about the opioid epidemic here in America and all the kind of issues with narcotics if used long-term. Traditional injections have some issues as well. That includes steroid injections have the potential to damage tissue, increase the risk of infection, diabetes, and osteoporosis. They can offer short-term pain relief, but they're not good long-term. Nerve blocks and radiofrequency ablation, which are frequently done by pain management physicians for pain as well, have the potential to cause nerve damage and muscle weakness as well. So lots of potential issues when you're just strictly utilizing a lot of the traditional solutions for shoulder pain. Other problems include, with surgery, significantly higher risk when it comes to bleeding, infection, tissue damage, general anesthesia risk, cardiac risk. Many routine surgeries are not actually proven to be effective, and routine nerve blocks that are frequently done at the time of surgery have the potential for lots of side effects as well. So in searching for a better option, we're really looking for options that have minimal side effects to low risk, where they can actually still improve the cause of the problem, and they can actually give you long-term improvement as well. So imagine reducing your pain and getting back to the activities you care about without surgery or pain medications. So regenerative medicine is the field of medicine where you utilize your body's own cells to treat musculoskeletal conditions, including arthritis, tendonitis, injuries, and back pain. It utilizes the normal healing process, namely that when you have an injury, you have an influx of cells and growth factors into that area, creates an inflammatory reaction, which then triggers that cellular healing process. Really classic example would be if you have a small cut over your finger, that you have platelets and growth factors that fill in the area, and then a slow progressive improvement in that wound or injury. The issues with that are that if you have areas or tissues that have poor blood flow, which include tendon, cartilage, ligaments, discs, labrum, and meniscus, that those do not heal very well. And so regenerative medicine is essentially, the goal is taking the cells that normally coordinate and create that healing process and to inject those into the tissue that's been damaged in order to help that poorly healing tissue to recover faster and more effectively. So why regenerative medicine? Regenerative medicine has the ability to help in the following ways: reducing pain, increasing function, treating the source of the problem, namely instability and inflammation. It's much lower risk than the alternatives, such as surgery, offering limited downtime post-treatment, minimal time off of work, minimal disruption of regular routine, minimal use of mobility tools such as crutches and braces, effective for the vast majority of musculoskeletal conditions. And really, for those of us who are very deeply involved in this, we feel that eventually 80% of traditional orthopedic surgery will eventually be managed by regenerative medicine. In the same way that traditional open heart cardiac surgery is now predominantly managed by cardiologists by doing needle-based procedures only. So how does regenerative medicine work? Really in a few different ways. Number one, it helps to optimize damaged cellular tissue. Essentially, when you look at a joint or tendon that's been damaged, what you find are cells that are no longer functioning well. They're no longer creating the proper enzymes or proteins for a healthy joint, tendon, or ligament. And so by injecting your own stem cells or growth factors or platelets into that area, you're able to get those cells that are traditionally now damaged and no longer working to start working more appropriately, which means pumping out the right kind of proteins and enzymes to create a healthier tissue. In addition, if you have cells that are significantly damaged or overwhelmed, injecting your own mesenchymal stem cells into that area can help to replace those cells as well. We can certainly help improve strength and stability of supportive structures, including ligaments, tendons, and other soft tissue structures, strengthening those supportive structures that are weakened, which then leads to better pain relief as well as better function. We also know that if you utilize these kind of cell-based treatments, you can actually help to reduce chronic inflammation longer term in joints and tendons. And essentially, in a chronically degenerative tendon or joint, you do have a small degree of inflammation, and we can actually help to reduce that or reverse that by injecting the right kind of cells into that damaged tissue. And then lastly, we can also improve neuromuscular health, which really drives a lot of dysfunction and pain as well. We can do that by reducing the irritation of nerves, reducing the inflammation in a damaged nerve, and by improving stability in the spine, where you may have a pinched nerve as well that's driving pain either in the shoulder as well. So some regenerative medicine basics. Is this legal? It's a great question. And the answer is yes, if done properly. So there are strict guidelines from the FDA now when it comes to regenerative medicine. Essentially, what is considered legally compliant and acceptable includes utilizing your own body cells. Cells cannot be significantly altered or adjusted, and they need to be injected into damaged orthopedic tissue. So using your own cells rather than using someone else's live cells. That's important to be legally compliant. Number two, they cannot be significantly altered. You may be hearing about things such as fat-derived stem cell treatments. That is considered illegal in the United States currently. The enzyme that's utilized for fat stem cell treatments is considered not safe or compliant by the FDA to be utilized in humans. You can utilize adipose or fat for structural issues, but you can't break it down to create stem cells. So bone marrow and blood is still compliant, however. And then lastly, needs to be injected into your own damaged orthopedic tissue. We're not talking about treating hearts and lungs and kidneys here. We're just talking about treating joints and tendons and other types of injuries. Another great question is, if you're older, shouldn't I use someone else's cells? And really the short answer is no. For the vast majority of orthopedic conditions, there's good evidence that using your own live cells is effective. Go with the data, go with the evidence. Your body is finely tuned to respond to your own cells, and so utilizing your own body cells still makes sense here, regardless of age. In addition, anytime you inject somebody else's cells, live cells, there's additional risks, including rejection, where your body kind of rejects the tissue. Number two, infection risk as well. You may actually have the risk of transmitting other illnesses into that person if you're utilizing someone else's live tissue. It is considered illegal in America to inject someone else's live stem cells into yourself, with the exception of certain childhood leukemias. Is there an age-limited treatment? And essentially, no. Certainly not for shoulders, knees, lower back, elbows, ankles, and the neck. Hip outcomes are different depending on age, but when it comes to shoulders, there is no limitation based on age. What sort of doctor performs these kind of treatments? I would strongly recommend the following. Number one, a physician who focuses on musculoskeletal conditions. If your doctor is doing plastic surgery in one room, giving dermal filters in another room, doing colonoscopies in another room, they really should not be injecting your spine, your shoulder, other areas like that. Just not safe, that does not make sense. That's not how medicine works. Medicine works by you specialize and get really good at something and you just continuously get better at it. It's really not possible to be a master of everything. Should be a physician who's focused on non-surgical treatments for orthopedic conditions. There is a big difference in training and outlook and perspective from someone who's doing orthopedic surgery, where they focus on generally either replacing tissue or cutting out tissue, versus if you're coming from a non-surgical standpoint where you're trying to optimize and heal and improve what a situation is by utilizing someone's own cells and tissue. And I'll talk about a little bit later of what makes a proper regenerative medicine expert. So can these treatments help if I've already had surgery? Simple answer is yes, unless the joint has been replaced. But if you've had, let's say, rotator cuff repair, there's actually fairly good evidence from Philip Hernigue in France that after rotator cuff repair, injecting your own bone marrow-derived stem cells can help reduce the risk of re-tear in that rotator cuff tendon. So definitely. My general rules, if a patient needs to consider orthopedic surgery, is as much as possible, try to keep your own anatomy and tissue. Try to avoid surgeries that cut out tissue, that leaves the area more unstable. Always consider a regenerative medicine treatment option if you have been recommended surgery as well. So regenerative medicine concepts, I'll be talking about stability, prolotherapy, orthobiologics, and image-guided injections. Stability. Stability is a critical and important concept when it comes to musculoskeletal health. Essentially, biotensegrity is a concept that if you take a structural unit, let's say the shoulder, and if you take the individual units, put them under compression and under close approximation, you have a overall structure that's stronger than the individual units by themselves. So as an example, in the shoulder, you have quite a few different structures that work in coordination to create strength and control and range of motion. That includes the various rotator cuff tendons, the ligaments around the shoulder joint itself, and all the nerves that go around it as well, and the myofascial tissue. When these are healthy and in close approximation, they offer stability, range of motion, and strength. If even one of those layers has been damaged, it can throw that off. And so the concept of prolotherapy is injecting your own cells into those supportive layers to help improve structure and strength and stability. And you do that because if even one unit in that entire structure is damaged, by strengthening even that one unit, you'll get a healthier overall functional unit. So there's this concept of layers and depth of treatment, where if you have, let's say, a rotator cuff injury, if all you do is inject that one tendon and you don't address everything else that's driving that, whether that's the ligaments that are unstable, whether it's the AC joint that's been stressed out as well, you won't do as well as compared to treating all of those areas. These treatments take time. The overall healing process from a platelet treatment can be up to 6 months, and after a bone marrow stem cell treatment can be up to 1 year. That progressive strengthening takes time, and it does offer longer lasting results as well. Shoulder stability. So improving stability leads to improvement in pain and function. You treat all the layers involved in pathology, and that's what gives you a better outcome. So as an example, if someone has a rotator cuff injury, when we're injecting your own cells, we're treating not only the tendon that's been injured, but the ligaments as well that have been chronically strained and are leaving that tendon vulnerable to instability and damage. If you have arthritis in the glenohumeral joint or AC joint, again, treating not only the joint that's arthritic, but the ligaments, the rotator cuff, as well as any nerve-related issues that may be impacting stability as well. And if you have a labral tear, treating not only where the labrum is torn, but all the ligaments that have been chronically strained that are leading to stress on that labrum. Stability is huge when it comes to shoulder pain and treatment. Orthobiologics are essentially the products, the biologic cells and tissues that we inject into damaged musculoskeletal tissue. Again, utilizing the body's own normal healing process, this is what helps you recover from an injury. You can use your own cells or someone else's cells, which we'll talk about in a moment. Again, you can only utilize your own living cells. You can utilize amniotic as well as umbilical cord fluid, which we'll talk about in a moment, and explain why that's not really a fully legitimate way to offer a regenerative medicine treatment. So platelets are really probably the first and foremost product that we use, platelet-rich plasma, platelet lysate. Essentially, after an injury, platelets recruit other cells and growth factors to assist in repair. This utilizes focused inflammation to help repair tissue damage. Platelet growth factors also help to stimulate your own local mesenchymal stem cells. So there's platelet-rich plasma, where we take a sample of your own blood, concentrate that into a very high concentration of your own platelets. There's platelet lysate, where we take those same platelets, crack them open, and just take the growth factors. The difference there is that platelet lysate kicks in immediately, while platelet-rich plasma takes about 7 days to kick in, the effectiveness. Both of these treatments basically help to stimulate your own mesenchymal stem cells, and they also help to strengthen any of the soft tissues that we inject as well. The preparation for this involves blood draw, centrifuge, kind of over multiple levels, and then concentrating it into what you want. The key here is that you want a very high concentration for joints, moderate concentration for tendons, and lower concentration for nerves and ligaments. If your physician doesn't have that kind of flexibility to alter your dosage based on what your condition is, you're not getting an ideal treatment. The picture on the right side shows platelet-rich plasma, which is on the left side, which is a yellow-orange color, where we've taken out all the red blood cells. That's less inflammatory, that's healthier for joints and tendons. And then we've got platelet-rich plasma on the right side, which still has the red blood cells, which is healthier for muscles, but you would not want to inject that into the joint because it's too inflammatory. If your physician doesn't have that kind of flexibility in terms of altering, again, what product is going to be injected into you, that's not the right way to do this. You should have that kind of specialization. So this is a case study of a man who has shoulder AC joint osteoarthritis, 35-year-old man with right shoulder pain. He's had significantly reduced exercise, difficulty doing overhead activity at work, and based on his examination, imaging, he has AC joint osteoarthritis. The AC joint is the joint on top of the shoulder. So in his case, he received platelet-rich plasma treatment into the right AC joint, the ligaments around that area as well, the inferior glenohumeral ligament and the superior glenohumeral ligament. His relief, and now he's roughly a year and a half out, is 80% pain relief. He's been able to get back to skydiving, which is something that he enjoys doing, and as well as working full-time, which includes overhead activity. So in this case, this is a picture of the AC joint. It's the top picture. This is the needle that's coming in, injecting into that AC joint. That's under ultrasound. It's an X-ray of that same picture. Again, there's the needle. There's a little bit of contrast in the AC joint. And that's how we confirm we're hitting the right area, how we're making sure we're getting cells into that right area as well. It's not a matter of guessing. It's a matter of being exact and specific every time. The next best known orthobiologic are stem cells. It's the main cell that drives tissue repair and recovery after an injury. Again, when it comes to utilizing cells, you should be using your own cells. There are risks with using someone else's cells. Bone marrow-derived stem cells are legally compliant in the US. fat stem cells are not compliant due to the enzyme required to inject in there. You can use fat and adipose for structural support. It's not exactly a stem cell treatment, but it is still helpful in some cases. Really important one to understand is that you may hear about amniotic or umbilical cord cells. Very important to understand this, in that while there may be doctors who will tell you that you're better off utilizing these cells because they are younger than your own cells, you need to understand that there are no living cells in that product. The way that these cells are prepared, essentially after birth, the tissue is collected, umbilical cord or amniotic fluid. They are then processed in a manner where they go through gamma irradiation, they're freeze-dried and created into they're basically pulverized into a powdered form. They're then shipped in a vial to the physician's office where they can sit on the shelf for 18 to 24 months. When they need to be used, you then inject some saline or water into it and then rehydrate them and inject them. That process does not result in any living tissue. There are no live cells in that. Multiple organizations, third-party organizations have looked at that. There are no live cells in that, and thus injecting those, there's some effectiveness for growth factors, but there's no living cells, so it's not a stem cell treatment, and you need to be careful if that's what's being recommended to you. Your doctor may either not understand the science or what they're offering, or they may just not be giving you the best treatment possible. IV stem cells are something you may hear about in other countries as well. No proven benefit for orthopedic conditions. Stick with what is known and effective at this time, which is utilizing your own platelets and bone marrow-derived cells. So this is a nice case of a gentleman, a 57-year-old man who has a full-thickness rotator cuff tear. And he was treated with his own bone marrow-derived stem cells and PRP. And he had actually a very good result in terms of he went from, on the left side is before treatment, he had pain with overhead activity and at night. And that tear is circled here. That gap right here is a full thickness tear in the tendon. It's another view of that. That is painful, and that's very clearly what's causing his pain. This is 3 months post-treatment. His pain is dramatically better, able to sleep at night and continue to work. And now you can see there's just a dramatic improvement in where that gap was and where that tear was. And that is a great imaging result and something that is still possible even if you have a rotator cuff tear. It's another case study. This is a woman who is a recreational tennis player who had shoulder pain. She had a labral tear. She received her own bone marrow-derived stem cells where we injected that into her shoulder labrum as well as ligaments around the shoulder. She is doing fantastic. She's roughly 75% improved and back to being able to play tennis again. This X-ray on the right shows the following. This is a needle within the shoulder, and you'll see a little triangular structure in there. That is the superior labrum. That's where her slap tear was. And then you'll also see the shoulder joint. That's right underneath that. And so she's had a great response because of that kind of thorough approach to treatment. So stem cell treatment outcomes. Understand that you can actually improve pain and function even in advanced cases. And that's because we can improve stability. In addition, we can improve inflammation. We can jumpstart cells that have been chronically damaged in a joint, tendon, or ligament or nerve tissue and get them to start functioning better. And as you get pain relief, we can also improve exercise tolerance, which then helps with strength and support of treated areas as well. Can we improve an X-ray or MRI image? I just showed an image of a tendon tear that got significantly better under ultrasound. If your rotator cuff tendon is severely torn, where the tendon is gapped and fully pulled away, where the muscle and the tendon has been pulled back to the bone, that requires surgery. Although even in that case, because there's such a significant high chance of re-tear post-surgery, you should consider getting your own bone marrow-derived stem cells injected at the same time, whether that's during surgery or post-surgery. It would be worthwhile to do that. So tendon tears can get better on imaging, but it's more about pain relief and functional improvement. If you have advanced arthritis, it's unlikely we're going to get an X-ray or MRI to look dramatically better, but symptoms will. Ligament tears, some of them can. If you have swelling in the joint, that can certainly get better as chronic inflammation reduces. And if you have bone damage, which is called avascular necrosis, if you catch it at an early enough stage, that can get better as well. Can we treat bone-on-bone arthritis? Or another way to say it is, can we treat conditions that are more advanced? So treatment of advanced, that should be shoulder joint arthritis, on average, still 70% improvement in pain. Again, understand that arthritis is a biologic condition that is treatable with orthobiologic treatment. There are some caveats to that. If you have more advanced arthritis, it's likely that bone marrow stem cells will do better than if you're just utilizing platelet-rich plasma. Your expectations still should be based on pain and functional improvement. Improving imaging is less likely. Okay, next issue is, what about image guidance to treat orthopedic injuries? If you talk to some of my colleagues who are a bit more experienced, a little bit older, they'll tell you that they can inject without requiring any sort of ultrasound or X-ray guidance. I do not have X-ray vision, and so I do require X-rays and ultrasound to get the right kind of result. And here's what I mean by that. So the image on the left is injecting into a rotator cuff tear. This is the needle. This is the rotator cuff that's being injected. That picture right there, where the needle is placed, is injecting into a tear in the tendon that is less than 1 millimeter in size. You cannot inject that blindly, meaning just palpating the skin. You really need to be able to see where you're injecting, and ultrasound allows that. This is again an example where I showed before about injecting into the labrum and into the shoulder joint. To inject the shoulder labrum, you really need to use a very high level of X-ray guidance skills. And so utilizing the tools that we have on hand, including image guidance, is how you can get a great result after treatment. So I'd mentioned that I'd give you some clues about figuring out if your physician is a regenerative medicine specialist. Number one, definitely they should be focused on only musculoskeletal issues, not dabbling in it. This should be their focus. They should be focused on non-surgical treatments. Again, if your surgeon is doing 95% surgeries and 5% this, you can get a sense for where their expertise and skill acquisition will be focused. It's likely not on the non-surgical end. They should really only offer you safe and effective treatments. So if your physician, I see this a lot in pain clinics, is offering you steroid injections, anti-inflammatory medications, or burning tissue as a form of pain relief, and then still saying that they're offering regenerative medicine treatment, they're not really practicing regenerative medicine adequately. In addition, your physician should understand candidacy ratings, meaning they should be able to tell you, are you a good, fair, or poor candidate? I find that a lot of times patients are told that they're poor candidates and their physicians are not aware of the evidence or the data, which is unfortunate because they're misguiding their patients. They may have the best intent in mind, but there may be a bit of ignorance in terms of what the evidence shows. Your physician should be collecting and publishing data. Nice aspect of being in the Regenetics network is that we are constantly collecting data in order to figure out what's working better and also putting that out for the general public to see. They should be utilizing image guidance for all treatments. Should never be offering you a blind injection. That's really the sign of someone who is not an expert in regenerative medicine. They should also understand how to treat instability, meaning if your physician is telling you, you have shoulder arthritis, we're going to inject into the joint only, and they're not treating all the other soft tissue structures, including the ligaments, the rotator cuff, they probably don't understand that regenerative medicine approach to treatment. They should know the exact concentration of platelets and stem cell counts that they're injecting, and they should have a lot of flexibility in terms of the product that they're offering. Most physicians do not have this. They're not sure of what the end product is that they're injecting, number one. Number two, they're also not aware of the actual stem cell count or platelet count of what they're injecting as well. And then lastly, they should understand the different types of orthobiologic products that are available. Again, in my experience, most physicians are not exactly aware of that. Many of them are not aware that umbilical cord and amniotic fluid products are not true stem cell products because there's no living cells. Again, another aspect of, are you an expert or not in this field? Regenerative medicine treatments offer safe and effective solutions for your pain. Wonderful. Is this too good to be true? The evidence would indicate that there is actually pretty good evidence that these treatments work quite well. Dr. Philippe Hernigue from France is an orthopedic surgeon. He has data that goes back to the early 1990s. In the Regenix network, there's data that goes back to 2005. It's important to understand that while this is a rapidly developing field, it's not a new field. If your physician tells you that there's not enough evidence of what works and what doesn't work in regenerative medicine, they're not aware of the data. In my own personal experience, I've been doing this since 2008, and I can tell you that the field has grown dramatically since that time. And this is not a new field. It's newer, but it's not new. And there's definitely good data to help guide you in terms of whether or not you're a good candidate or an appropriate candidate for treatment. Also understand that there are definitely right and wrong ways to do this. I know of a number of patients who've been treated in ways where you realize that they didn't really get an ideal treatment protocol or approach, which is why they had a limited effectiveness of treatment. And lastly, you want to make sure your expectations are grounded in reality and evidence-based medicine so that you can get an appropriate result and so that you can make an appropriate decision as to your treatment. How long do results last? So Regenix has data that goes up to 10 plus years now. Philippe Hernigue from France has data that goes to 20 plus years. My recommendation is the following. If you have a chronic condition, expect that a repeat treatment at some point a few years after initial treatment would be helpful. We know that repetitive treatment or exposure to your own cells can give better, longer lasting results and tends to give progressive improvement in a stairwise fashion where you have significant improvement for some period of time. And if you get a repeat treatment, you're then stair-stepping to a higher level again. The best way to maintain results after a treatment, improve your biomechanics, take the right kind of supplements, do all the right kind of corrective exercises, and repeat treatment is additive to the initial treatment if required. Cost. So these procedures are currently not routinely covered by insurance. However, Regenix Corporate has started to negotiate and arrange to have various self-insured companies to add these procedures to their benefits plan. That's a very exciting thing. TRICARE, the military insurance, has started to cover PRP for lateral epicondylitis or tendon elbow, as well as knee osteoarthritis. So there is definitely hope on the horizon. Expect your cost of treatment around the US to be roughly $1,500 and up for PRP and $6,500 and up for stem cell treatment. The keys to determine value, number one, are the physician and clinic regenerative medicine experts, yes or no? Are you receiving a real stem cell treatment or a bogus amniotic or umbilical cord product mislabeled as a stem cell treatment? Again, yes or no? And lastly, this is an in-office procedure. You can avoid hospital and surgery centers and their expensive facility fees when it comes to determining cost and value. So here at Chicago Arthritis and Regenerative Medicine, our approach is that we're focused on non-surgical treatment for your arthritis, tendonitis, injuries, and back pain. Our evaluation focuses on inflammation, instability, asymmetry, neuromuscular issues. Generally, first line we correct with low-risk supplements and exercises. If that's not working, then we escalate to regenerative medicine treatment. utilizing really the highest quality products from your own body, a plan that is very specifically tailored for your own condition and needs, and a procedure approach and lab prep approach that focuses on what your particular issues are, and delivery of cells utilizing the highest level of image guidance so that we're making sure we're always hitting the correct area that needs to be treated. How do I get evaluated? So if you're on the webinar, you'll see pop up on the right a quick and easy way to schedule. There we go. If you're watching this on replay or watching this on one of our social channels, you can always email us as well at chicagoarthritis.com, where we can help out with any questions that you have. We can also assist in scheduling or helping you to learn more about your condition. Great. Well, I hope that was educational and useful when it comes to understanding regenerative medicine treatments and options for shoulder pain, whether that's rotator cuff tendonitis from your sport that you play, or whether that's chronic shoulder arthritis from a long history of wear and tear to the shoulder, or whether that's even treating a recent onset shoulder injury. Regenerative medicine treatments, when performed in a proper and effective manner, can be incredibly helpful to treating your pain and improving your function. Thank you for your time. If I can be of further assistance in any way, you can look me up at chicagoarthritis.com. And until we connect again, have a good day and live well. Bye-bye.